Hi there, this is Physio Paul. Your YouTube tutor is here to bring you a new topic for discussion, that is, electrocardiography. Here we go now.
Overview of electrocardiogram.
An electrocardiogram records the electrical signals in your heart. It's a common and painless test used to quickly detect heart problems and monitor your heart's health. Electrocardiograms, also called ECGs or EKGs, are often done in a doctor's office, a clinic, or a hospital room. ECG machines are standard equipment in operating rooms and ambulances. Some personal devices, such as smartwatches, offer ECG monitoring. Now we need to know what is the relevance of cardiography as a medical testing procedure. So, why it is performed on an individual.
The reason why electrocardiography is performed.
An electrocardiogram is a painless, non-invasive way to help diagnose many common heart problems in people of all ages. Your doctor may use an electrocardiogram to determine or detect 1. Abnormal heart rhythm, arrhythmias. 2. If blocked or narrowed arteries in your heart, coronary artery disease, are causing chest pain or a heart attack. 3. Whether you have had a previous heart attack. 4. How well certain heart disease treatments, such as a pacemaker, are working. 5. Cardiac myopathy, where the heart walls become thickened or enlarged. You may need an ECG if you have any of the following signs and symptoms: 1. Chest pain. 2. Dizziness. 3. Lightheadedness or confusion. 4. Heart palpitations. 5. Rapid pulse. 6. Shortness of breath. 7. Weakness, fatigue, or a decline in ability to exercise. If you have a family history of heart disease, your doctor may suggest an electrocardiogram as a screening test, even if you have no symptoms. If your symptoms tend to come and go, they may not be captured during a standard ECG recording. In this case, your doctor may recommend remote or continuous ECG monitoring. There are several different types. Now let's discuss about the types of ECG monitoring.
Types of ECG.
There are 3 types of ECG monitoring. 1. Stress test. Some heart problems only appear during exercise. During stress testing, you'll have an EKG while you're exercising. Typically, this test is done while you're on a treadmill or stationary bicycle. 2. Holter Monitor. This testing procedure is also known as an ambulatory ECG or EKG monitor. A Holter monitor records your heart's activity over 24 to 48 hours while you maintain a diary of your activity to help your doctor identify the cause of your symptoms. Electrodes attached to your chest record information on a portable, battery-operated monitor that you can carry in your pocket, on your belt, or on a shoulder strap. 3. Event recorder. Symptoms that don't happen very often may require an event recorder. It's similar to a Holter monitor, but it records your heart's electrical activity just when symptoms occur. Some event recorders activate automatically when they detect symptoms. Other event recorders require you to push a button when you feel symptoms. You can send the information directly to your doctor over a phone line. Now, I'm going to discuss these techniques in details.
Holter Monitor, the advanced ambulatory ECG monitoring procedure.
A Holter monitor is a small, wearable device that keeps track of your heart rhythm. Your doctor may want you to wear a Holter monitor for 1 to 2 days. During that time, the device records all of your heartbeats. A Holter monitor test may be done if a traditional electrocardiogram (ECG) doesn't give your doctor enough information about your heart's condition. Your doctor uses information captured on the Holter monitor to figure out if you have a heart rhythm problem. If standard Holter monitoring doesn't capture your irregular heartbeat, your doctor may suggest a longer-term monitor, which can record your heartbeat over several weeks. Some personal devices, such as smartwatches, offer electrocardiogram monitoring. Ask your doctor if this is an option for you. Now we are going to discuss why it's done. Your doctor may recommend that you wear a Holter monitor for a day or so if you have signs and symptoms of an irregular heart rhythm, arrhythmia, or unexplained fainting. Before you get a Holter monitor, you'll have an electrocardiogram (ECG). An ECG is a quick and painless test that uses sensors, electrodes taped to your chest to check your heart's rhythm. However, Sometimes an ECG doesn't detect any changes in your heart rhythm because you're hooked up to the machine for only a short time. A Holter monitor may be able to spot occasionally abnormal heart rhythms that an ECG missed. A Holter monitor test may also be done if you have a heart condition that increases your risk of an abnormal heart rhythm. Now let's discuss about the risk of Holter monitoring if there is any. Risks. There are no significant risks involved in wearing a Holter monitor other than possible discomfort or skin irritation where the electrodes were placed. However, the Holter monitor can't get wet, or it will be damaged. Don't swim or bathe for the entire time you're wearing your Holter monitor. However, if you have a wireless Holter monitor, you'll be shown how to disconnect and reconnect the sensors and the monitor so that you can shower or bathe. Holter monitors aren't usually affected by other electrical appliances. But some devices can interrupt the signal from the electrodes to the Holter monitor. If you have a Holter monitor, you should avoid the following: 1. Electric blankets, 2. Electric razors and toothbrushes, 3. Magnets, 4. Metal detectors, 5. Microwave ovens. Also, keep your cell phones and portable music players at least 6 inches from the Holter monitor for the same reason.
How to prepare a patient before Holter monitoring.
If your doctor recommends a Holter monitor, you'll have the device placed during a scheduled appointment. Unless your doctor tells you otherwise, plan to bathe before this appointment. Most monitors can't be removed and must be kept dry once monitoring begins. A technician will place sensors, electrodes, on your chest. These electrodes detect your heartbeat and are about the size of a silver dollar. For men, a small amount of hair may be shaved to make sure the electrodes stick. The technician will then connect the electrodes to a recording device with several wires and will instruct you on how to properly wear the recording device so it works properly. The Holter monitor recording device is about the size of a deck of cards. Once your monitor is fitted and you've received instructions on how to wear it, you can leave your doctor's office and resume your normal activities.
What can a patient expect from this monitoring?
Expectation during the monitoring. Holter monitoring is painless and non-invasive. You can hide the electrodes and wires under your clothes, and you can wear the recording device on your belt or attached to a strap. Once your monitoring begins, don't take the Holter monitor off. You must wear it at all times, even while you sleep. While you wear a Holter monitor, you can carry out your usual daily activities. You'll usually be given a form to help you record your activities and any symptoms. It's particularly important to note if and when you have any of the following symptoms: 1. Any pounding, fluttering or skipped heartbeats. 2. Shortness of breath. 3. Chest pain. 4. Lightheadedness. Write down what activities you do and exactly what time you do them. Your doctor will tell you how long you'll need to wear the monitor. It may vary from 24 to 48 hours, depending on what condition your doctor thinks you have or how frequently you have symptoms of a heart problem. A wireless Holter monitor can work for weeks. After the monitoring, once your monitoring period is over, you'll return the device to your doctor's office. If you were asked to keep a record of symptoms that you had while wearing the device, your doctor can compare data from the Holter monitor recorder with your notes. This can help your doctor diagnose your condition.
Result of Holter monitoring.
After your doctor has looked at the results of the Holter monitor recorder, he or she will talk to you about your results. The information from the Holter monitor can tell your doctor if you have a heart condition and if heart medicines you currently take are or aren't working. If you didn't have any irregular heart rhythms while you wore the monitor, your doctor may not be able to diagnose your condition. Your doctor may recommend a wireless Holter monitor or an event recorder, both of which can be worn longer than a standard Holter monitor. Event recorders are similar to Holter monitors and generally require you to push a button when you feel symptoms. There are several different types of event recorders.
Exercise stress test.
An exercise stress test is used to determine how well your heart responds during times when it's working its hardest. During the test, you'll be asked to exercise, typically on a treadmill, while you're hooked up to an electrocardiogram (EKG) machine. This allows your doctor to monitor your heart rate. The exercise stress test is also referred to as an exercise test or treadmill test.
Purpose of the testing.
An exercise stress test is primarily used to help your doctor determine if your heart receives enough oxygen and proper blood flow when it needs it most, such as when you are exercising. It can be ordered for people who have been experiencing chest pains or other symptoms of coronary heart disease, also called coronary artery disease. An exercise stress test may also be used to help determine your level of health, especially if you are starting a new exercise program. This allows your doctor to learn what level of exercise you can safely handle. If you are a smoker over 40 years old, or if you have other risk factors for heart disease, you should talk to your doctor to see if an exercise stress test is a good idea for you.
Risk factors.
Stress tests are generally considered safe, especially since they're done in a controlled environment under the supervision of a trained medical professional. However, there are some rare risks, such as 1. Chest pain. 2. Collapsing. 3. Fainting. 4. Heart attack. 5. Irregular heartbeat. However, your risk of experiencing these reactions during the test is low, since your doctor will screen you for problems beforehand. People who run the risk of these complications, such as those with advanced coronary heart disease, are rarely asked to do the test.
Preparation for test.
Prior to your test, your doctor will perform a physical exam and ask about your complete medical history. At this point, tell your doctor about your symptoms, especially any chest pains or shortness of breath. You should also tell your doctor about any conditions or symptoms that may make exercising difficult, such as stiff joints from arthritis. Finally, let your doctor know if you have diabetes, because exercise affects blood sugar. If you do have diabetes, your doctor may want to monitor your blood glucose levels during the exercise test as well. The day of the test, be sure to dress in loose, comfortable clothing. Something that is light and breathable is best. Make sure to wear comfortable shoes, such as athletic sneakers. Your doctor will give you complete instructions about how to prepare. These instructions might include 1. Avoid eating, smoking, or drinking caffeinated beverages for 3 hours before the test. 2. Stop taking certain medications. 3. Report any chest pains or other complications you notice on the day of the test. You should only stop taking medications if your doctor tells you to do so.
Test procedure.
Before you begin exercising, you'll be hooked up to the EKG machine. Several sticky pads will be attached to your skin under your clothes. Your doctor or nurse will check your heart rate and breathing before you begin exercising. Your doctor may also have you breathe into a tube to test the strength of your lungs. You'll start off by walking slowly on a treadmill. The speed and grade of the treadmill will be increased as the test continues. If you experience any difficulties, especially chest pains, weakness, or fatigue, you may ask to stop the test. When your doctor is satisfied with your results, you'll be able to stop exercising. Your heart rate and breathing will continue to be monitored for a short while afterward.
After the test, you'll be given water and asked to rest. If your blood pressure rises during the test, your attending nurse may continue to monitor your blood pressure. A few days after the test, your doctor will review the results with you. The test could reveal irregular heart rhythms or other symptoms that indicate coronary artery disease, such as blocked arteries. If your doctor determines you may have coronary artery disease or other heart problems, they may begin treatments or order more tests, such as a nuclear stress test. Implantable loop recording cardiography, event recording.
An implantable loop recorder is a type of heart monitoring device that records your heart rhythm continuously for up to 3 years. It allows your doctor to remotely monitor your heartbeat while you go about your daily activities. The small device, also called a cardiac event recorder, is placed just under the skin of your chest during a minor surgery.
Purpose of using such technique.
Your doctor may recommend an implantable loop recorder if you have 1. An abnormal heartbeat arrhythmia. 2. An unexplained stroke. 3. Unexplained fainting syncope. An implantable loop recorder can capture information that a standard electrocardiogram (ECG) or Holter monitor may miss, particularly arrhythmias that are brief or infrequent. For example, if you're having fainting spells, your doctor will want to know if a problem with your heart is causing your symptoms. A standard ECG only records your heartbeat for a few seconds or minutes. An implantable loop recorder monitors your heartbeat for a much longer time, so it's more likely to capture what your heart is doing if you faint again. Information from an implantable loop recorder can help your doctor confirm a diagnosis and develop your treatment plan. Your doctor may also recommend an implantable loop recorder if you're at high risk of stroke. Certain arrhythmias, such as atrial fibrillation, increase your risk of stroke.
Expectation by patient.
During an implantable loop recorder is placed under the skin on the chest. The procedure to insert the heart monitor is usually done in a doctor's office or medical center. You'll be awake for the procedure but may be given medicine to relax you, sedative. The area of skin on the chest is numbed. Your doctor makes a tiny incision, inserts the device and closes the incision. The device will stay in place for up to 3 years. After, complications of the procedure are quite uncommon. However, because minor surgery is done to implant the device, you'll need to watch for signs of infection such as redness or swelling. Your doctor and nurse will tell you what to look for. You may need to limit activities until the wound heals. You'll be given a transmitting device to place beside your bed. The transmitter automatically sends information from your implant to your doctor while you sleep. You can also push a button to send data immediately when you have symptoms. Your doctor may ask you to keep a diary of your symptoms and when they occur.
Result.
Your doctor will interpret the results of your test and call if he or she has any concerns. You'll likely need to see your doctor once or twice a year for routine checkups while the device is in place. An implantable loop recorder is invisible and doesn't interfere with your daily activities. It has no patches or wires. You don't have to worry about getting the device wet while bathing or swimming. An implantable loop recorder is considered safe for use during magnetic resonance imaging (MRI), but always let your doctor know about your implant before you schedule such an imaging test. It's also possible that an implantable loop recorder might set off metal detectors, for example, at an airport. Your doctor can provide you with a device identification card to carry with you for such situations.